that don't know me. I think everybody does, but I just want to say officially welcome back to the spring semester. Um, it's funny how last semester it was like really Zoom again, and now it's like, hey, hi, good to see your face. It really is good to see
Sorry.
everybody's face.
I have a Zoom meeting, and so I'm like acting like I'm on my meeting. And
Elizabeth,
hey, I'm getting off the phone with Allstate right now. I'm hanging up. So sorry, guys. Okay, bye. Thank you. Okay, I'm here.
There you go. Okay, so we have a shortened retreat today, but still a very good one. I think you'll all enjoy. I want to mention that all of the sessions today will be recorded. And if you have any questions at all, yes, please took the words right out of my mouth, Lynn. Put your name in the chat if you have a question. Well, first of all, ask your question in the chat box so that we can have a record of all of those. And if any of y'all have questions we don't get to during the meeting, we can get to them after. And then also please put your name in there. So we'll have a record of attendance. And we are monitoring the chat box for questions during. If you prefer to raise your hand to ask a question, we are also monitoring the the raised hand feature. So either way you want to do it, feel free. And I think that's all. Dean Heath, if you're ready. You're muted.
Thank you, Joanne. Joanne Davis keeps me straight. Anyway, I'm always ready. I just get my mute button turned off. So welcome everyone. And I thank you too for joining us. Right now, we've got over 105 in attendance. So that's really, really great. And I have to tell you, I'm really, really ready for the semester to get started. I have missed you and missed our students. I hope we can keep with our faculty organization mantra of starting meetings with a moment for mission. This image reminds me that in the midst of all the chaos we have seen and all the unrest that has broken our hearts, there is the promise of this new year and the power of the work we do with our College of Nursing family to bring hope, compassion, resilience, and healing. And we do that so that our learning and working environments can thrive. Many thanks to Dr. Candace Falls, I saw her on Zoom, for compiling this image that has been showcased in our engagement magazine, which I promise it will be hard copy in your hands soon. But she compiled this image of herself and her UK healthcare colleagues. Now that was in May 2020, when our country hit the 100,000 mark of deaths due to COVID-19. Now we are rapidly approaching 400,000 deaths. And in Kentucky, we are rapidly approaching 4,000 deaths. There is not a one of us, I bet, who does not know someone that was or is COVID positive. Last semester, you might remember we had over 160 nursing students that were positive. Over the holiday break, several families in our college were impacted, some quite ill. Even one college member's father was near death. Another had an entire family that was COVID positive. 3 of my family members were hit. And yet I am so grateful, though, we have not lost any lives in our college from COVID. This issue of engagement is entitled Reflecting Back and Looking Ahead. And as thrilled as I am that 2020 is behind us, I cannot help but still think about all that we went through and actually continue to go through. And I am reminded of the wise words offered by our President Abraham Lincoln in 1861, when he said, "The best way for the nation to navigate through a storm was to appeal to the better angels of our nature." So let's look forward to the better angels for our college and our nursing profession to continue to thrive in several key priority areas. There are a lot of great standout moments that happen in our college all the time, but the ones featured in our magazine that take my breath away are the stories about students and how they powered through adversity. By low-cost initiatives like this memo board reminding us, and our students made this, to be kind, be thoughtful, be genuine, but most of all, be thankful. I am most grateful for this work that our college is doing to help influence the lives of our students to do such impactful initiatives such as this. Our 2021 is already loading up, and I thank you for taking the time to be with us today, especially since I know you're trying to get your coursework all up and loaded, and yet you took time to join us for the spring retreat. So let's look ahead and see what's coming. Look close at this slide and see if your eyes are as good as Terry Lenny's. I was on a Zoom with this colleague of ours going through some agenda items, and just when I think we're through, this pops up. Oh, one more thing I need to update you about. For those of you who haven't heard the news, Camille Burnett had a private family wedding on January 1st. It is an amazing story, and now we truly have a real partnership with the College of Agriculture with her marriage to Kevin Lindsay. Congratulations, Camille. So what's loading up for us? COVID control continues to be a #1 priority area for us to support and to manage and lead. Perry has built our update page as a web page rotator. Karen Butler is keeping the playbook updated. Thank you, Karen. And Hartley Feld is the faculty lead for our college to help with the vaccination distribution plan. Thank you, Hartley. It will pretty much be the same mode of operation as last fall. Safety measures are in place. We will continue to walk it and talk it and follow the 4 W's. We'll continue to work remotely and teach remotely as we can, with a little bit more of a ramped up effort on our part for face-to-face with our undergraduate students, mostly in areas of high need. We also will continue to ensure great online engagement strategies with both our undergraduate and our graduate students. And certainly we'll continue with our plans for research and practice phases coming up with the matching of protocols as appropriate. I'm really excited that we will be on the front lines to help support the vaccination efforts for the university at large, students, faculty, and staff. I was on a call meeting for all the SEC nursing deans yesterday, and pretty much everyone is ramping up by having all their new nursing students learn vital signs, PPE, and IM injections on the very first day. So many thanks for all of you for what you're doing to support this massive operation, this massive demand and need. And if you haven't already, please let Hartley know of your interest and availability yourself, whether it's faculty or staff. There's roles for all of us, and certainly with your students. Our second priority area is tied up there with the COVID control. The COVID-19 mental health tsunami is in full force, more so than I ever dreamed possible. Just a quick story about what is happening in our school before, or our college before it's even started. You might have already started hearing some of these stories yourself from students reaching out to you. So on Tuesday, Dr. Leanne Wamsley and I did a Zoom with a student that was in quite a bit of stress. This is a rising second semester sophomore nursing student who, thank goodness, reached out for help. She struggled with mental health in the fall, yet she kept that close to her chest, and she finished with a 4.0. And it really has hit her during this break. She's escalated with anxiety and depression, thinking that she may not be able to come back to the college and complete her program of study. She lives in Maryland, and she's in a household of a family that have made a lot of poor health behavior choices. There's been loss of jobs. You name it, she's been in the middle of it. And hopefully we'll see our student return in a couple of weeks, and that'll all be because of Leanne helping to line up the resources that she's going to need to be successful. Speaking of students, this is Madison Johnston. Many of you may remember her. She's being featured in the Engagement magazine. She's a graduate of May 2020. She's another great story of faculty and staff being a lifeline of support for our students with mental health challenges, as well as physical challenges, in particular with Madison. And still, she engages with our college for UNAC and GNAC, toy drives for the Children's Advocacy Center, where she works here in Lexington. This is another great example of a return on the investment for supporting mental health and wellness in our college. And if you haven't heard it yet, this is the year of the nurse being extended. The World Health Organization and the American Nurses Association made that very critical and really greatly appreciated decision. Now, we are already engaged at the state level as well as the national level with special programming and even legislation for a Kentucky Nurse Suicide Prevention Day, plus a whole month of programming to include QPR training. We really are making a difference with our 4 W's. And once again, I'm just so grateful for that last 4th W to make sure that we are working in the wellness, as well as wearing our mask, watching our distance, and washing our hands. And I just have to tell the Work-Life Engagement Council, I love that acronym. That is so cool. And thank you for those Wednesday messages. So moving along with another priority, it hasn't gone away. CCNE accreditation is coming up. So I just want to share a few updates with you about what we've got on board for success with that important piece of work that we've got up ahead of us. Although the second floor has done amazing work and we have CCNE expertise here right with us, Dr. Evelyn Parrish, and we actually have Dr. Patty Hughes that have been active with site visits for many years. There is always the worry that we didn't document something correctly or effectively, or we didn't provide the evidence to back it up. Also, another concern is the stability of virtual site visits. How will our platform be holding up the day that they actually come see us virtually? How are those links going to be holding up to make sure that they see the information they need to see? So the answer is we will be ready, because I am confident about those CCNE angels are going to be with us, and we're going to have a super great outcome. Dr. Lenny and Evelyn will be giving an update later this morning. So I just want to highlight to put it down on your calendar, the virtual site visits. We will be getting information out to you as soon as possible when we know what that exact agenda is going to look like. Predominantly, there will be specified Zoom meetings with select groups that will be determined. People, individuals like our clinical partners, our community partners, academic program leaders. So we plan to schedule some mini mocks and some FAQs for faculty, staff, and students. So we'll be getting more information to you in the next actually few days that are coming up. And I can just tell you though, that they will really be interested in a lot of our amazing outcomes when they read about our NCLEX pass scores rates, when they read about the strategies that we've put in our college for academic success, like First Day Friday, or managing simulated learning environments during a pandemic. They're going to want to hear more about it. So they'll want to be hearing from faculty, staff, and students that are engaged in those areas so that you can verify, yeah, we did that. So our work with redesigning, restructuring, re-envisioning diversity, equity, and inclusivity as a progressive, forward-thinking, and doing with action of accountability initiative is really shaping up nicely. A lot of work has been done since we last reported off. There have been multiple forums, discussion groups, meetings, presentations with literally over 45 individuals. Now that includes my advisory board, external constituents, and of course the provost office. Right now, there are 3 documents in the hands of the task force to review the job description for leadership, review the council function work and composite of that council, and the organizational structure placement. So next steps will be to integrate their input, present it to the Dean's Council, Senior Administration for review and approval, then post the position for leadership, start the selection process, and I hope to be able to say that we'll be able to make our announcement February 26th or earlier. Okay, let's shift gears a little bit. We have a lot going on, and if you think about it, we always do. Yet somehow we continue to crank out innovative programming. And somehow we continue to grow our research and our practice and our service. You know how the saying goes, busy people find ways to make amazing opportunities possible if they are passionate about it. And we've got a lot of passion in our college. So I want to share with you today something that I've been passionate about for a long time, just to see what you think. I've had the great fortune to lecture and present on the power of the voice of nursing for a long time. And now I am immersed with the DNP students doing the MIP series, which stands for Make It Pop, for their leadership and career advancement. And that includes a session on lights, camera, and action training session. So here's the idea, media making mission. This isn't my tagline, but one that's been introduced to me recently that I'm excited about. Here's why. Yes, nursing is in the media now because of the pandemic. Yes, nursing's hot. We always have been, but our voice needs to be in the media every day without a pandemic going on. So we need to keep that momentum going. We need to leverage it more. Why? Because we can and must. Our college is a top-ranked, research-intensive flagship college, and nursing is the most trusted profession, so it should be our voice that's out there. Our engagement magazine is full of rich stories that can be shared and told over and over in different ways. And there's always new stories that I really think the time is now. It really is our responsibility and opportunity to raise the voice of nursing. We've got a good start that I'm going to be happy to share with you some results of a pilot program that we implemented last fall with several faculty and DNP students and staff. And because of that work, we've gotten the attention of some state partners and some national partners that are very interested in helping us move forward to get to a better place with our media presence. And the way I like to look at it is we've got some stars in this college that are just media magnets, and I want to be able to keep that magnetism going throughout the building for students, faculty, and staff. But let's back up so everyone is on the same page about the data. Landmark studies that have shown that nurses have been, there are landmark studies that have shown nurses have been missing in action And the one that is the landmark is the one that was done by Sigma Theta Tau International Commissioning, and that's the Woodhull study. And that was done 24 years ago, where it showed over a 4-week period that nurses were only quoted 4% of the time in the news media. In 2007, non-nurses Bernice Beresh and Suzanne Gordon came out with their classic book, From Silence to Voice, telling us our silence is hurting care delivery, causing lives to suffer or hurt the image of our profession. Then in 2013, they came out with another book, and it pretty much said, are you listening to us? You're not making much progress with getting your voice out there. You all may remember when Dr. Diana Mason was one of our distinguished lecturers, she shared her research, which was a follow-up study that she modeled after the Woodhull study. And guess what? We went backwards. She did the same study over a 4-week period to see how many nurses were being quoted in the media, and it was only 2% of the time. Her research was conducted in 3 phases. And the first phase took a deep dive with what was reported in the newspapers, news articles, and industry articles. And you can see the wide discrepancy between quotes from physicians and dentists compared to nurses. Not good. In phase 2, she evaluated social media. Out of the top 45 schools of nursing that agreed to participate in the study, you all may remember I called her on the carpet, like, why didn't you include the University of Kentucky? But she evaluated those 45 schools and looked at their Twitter accounts and found that 80% were inward facing and only 20% were outward facing. Now, I had no idea what that meant, so I asked Perry Barrows, our communication director, to help me understand. And here's what she told me. It really is about how we do our hashtags. So if we say Big Blue Nation Nursing Rocks, that's inward facing. If we say hashtag Save a Life, Wear a Mask, that's outward facing. Even though we were not in the study, I asked Perry just what did she think? Where would we fall? Would we fall in that inward 80% or the outward 20%? And she said we would be in the 80%. So here's an example to show you with a simple Google search. When you type in University of Kentucky Nursing in the news, this was just yesterday, and these were the top headliners. It is us, College of Nursing, all over the place. Thank you very much. Then you tweak it just a little bit differently, and you enter Kentucky Nursing in the news. We still pop up. But, you know, these are all strategies and how the messaging goes out, how it's titled. A lot of Kentucky Nurses Association, which is great, but we're also in the mix of nursing homes. And then when you look at YouTube and you do the same thing, type in the search engine, University of Kentucky Nursing. Wow. And this is not our College of Nursing YouTube channel, but you can see University of Kentucky College of Nursing is all over the place. And looky there, that Dr. Dakia Talbert is hot. And how about that Joanne Davis? She popped up too. So you guys are gonna have to check those out. And then to phase 3 of Dr. Mason's study, she took a deep dive into the why. What is going on? So she went straight to the source and interviewed news reporters. No surprise, reporters do not know us. They do not know our work. They do not know how to reach us. And if they do, what they find is we don't step up to the call or the opportunity. The other thing that was really interesting and striking to me, when there is a major scientific discovery in medicine, the medical journal that is going to publish that study, they start off hitting that press release button to promote the study hot and heavy. Why don't we do that with our scientific nursing journals? In medicine, it is a well-oiled machine. And in nursing, like so much, we have to work harder. And I don't even really think we even have a media machine yet to get it well-oiled. But I am excited to think that we, College of Nursing, might be able to turn that around. Now, here is some data that Perry pulled for us. Look at the top Facebook posts for 2020. Also note that our Facebook followers for 2020, there were almost 4,000. Now we have over 8,000 alumni by now, so there's lots of opportunities that we can bump up those numbers. But look at the top post, the dean's list. Joanne, no wonder we get all these phone calls. Darlene and Kristen, when we leave somebody's name off, oh my word, we hear from them, their mothers, their fathers, their grandmothers. But wow, that's like number one. NCLEX pass rates, Wednesday wisdoms, which I didn't even know we were doing that and what that's about, but that's very inspirational quotes that we can thank our Work-Life Council for, and UNAC and GNAC for working on. And then the other thing that wouldn't surprise you has to do with our NLN designation. Now look at the Instagram account data. Once again, NCLEX pass rates are up there at the top. Lynn Kelso, how about that when she got vaccinated back in December? Jennifer Cowley, virtual teaching. Erin Chiswell, production assistant. I didn't even know about that, but Erin had her dog up there in the sim lab helping her one day with some work she was doing when we were doing our simulated learning last fall during the pandemic. Of course, Nick Alfred, and then our own Park and Pen ceremony video was a hot one as well. So we have close to 1,700 followers. Let's just see what we can do moving forward to get that number to a better place. And then looking at our Twitter account, we have 1,700 followers in 2020. Maybe not as many followers, but as some of the other accounts, but oh my goodness, look at the hits and the top post. Our COVID ambassadors work, they really like that, what we did with our faculty and our staff. They love the Fab Five video, Nurses Week video, Marcia Hughes Reese with her lectureship, and the College of Ag partnership for farmer suicide prevention. I thought that was really great. And then they actually also picked up on the Washington, D.C. legislative panel that we were on for Cancer Prevention Day. So I think that those are really exciting pieces of data to look at. Now, this one is also full of great data. It shows our hits in the news, where our college was mentioned or nursing faculty were mentioned. Predominantly, this was in the area of op-eds and blogs and our research studies. So you can probably think back to why certain years were higher than others and certain months were higher than others. One that I looked at was 2014 on my arrival, and I thought, wow, what happened in April? Well, that's when I got here. So that's kind of a given. You know, they push out a lot of news when you have a new dean. We're not sure what the September jump was. So Perry's going to look into that data. 2016, 292 hits in November. Not really sure what that was about. Then the other one that caught our eye was 2018 with 100 hits in February. Not really sure what that one's about, but I can tell you that Perry is charged up and excited to help us track this data so we can always monitor it and look at the way that we can get to a better place with raising the voice of nursing and promoting health and wellness. So here was a pilot that took place in the fall that I'm really excited about. And I have to tell you, it was truly coincidental. As I was doing the MIP series for the DNP students, this wonderful opportunity came across my desk. A proposal to train a cohort of faculty and DNP students and staff in partnership with experts in the field. The best part is that this was funded by a private donor, a beloved supporter for our college and UK Healthcare. and she set up a special gift for leadership advancement and development for nursing academics and clinicians. So we invested in this initiative to support what's called the ANLIT Scholars, and that stands for Academic Nursing, and we put in parentheses, Clinical Leaders in Training Scholars and DNP students to participate in this media training workshop with Dr. Mason and Barbara Glickson. All kudos to Dr. Camille Burnett and Dr. Julie Marfell for writing the proposal, securing the funding, and coordinating the workshop to integrate in their course. And I couldn't remember what course it was, so Julie or Camille, why don't you type in the chat box what the name of that course was and the course title, so people can follow back up with you to hear more about it. Okay, I'm going to continue on. So the course was broken into 3 sessions. There were approximately 6 hours of content, Zoom engagement in all, and there were also some homework assignments. Part of their assignment, which were really expected deliverables as ANLIT scholars, was to develop their pitch for health or an area that they're very passionate about, and for them to present that pitch to be critiqued by real news reporters. And I'm not just talking any news reporters. We had the Lexington Herald, we had Kaiser Family Foundation News, and believe it or not, New York Times. So it was really awesome. I'm going to ask Perry if she would drop in the chat box a link so you can listen to the 3rd session. There were 3 sessions, they were all recorded, but the 3rd one will just take your breath away when you hear the stellar work of our DNP students. So the reporters gave feedback on how the participants could really get their sound bite down with precision, clarity, and at the level of the audience. So they would be ready to step up with media opportunities. And I have to tell you that we've had some great success already with that. And once again, I do hope that you have a chance where you can listen to our faculty as well as our students. 2 outcomes that I am aware of that did come out of that, because you can see when we did the evaluation of the programming that overall everyone loved the workshop. But you know us as academics, and we're going to give the feedback. So the recommendation was, it really wasn't really great timing, and participants felt like it would be of more value for them if it was in the summer. Also having clear expectations of what those deliverables need to look like and what the expectations were to be an ANLIT scholar. And then moving forward for us to look at building resources and an infrastructure for sustainable outcomes that are not like a one and done training opportunity, and to integrate and leverage our own college of faculty, talent, and staff in the program. So I'm excited to make this happen. And before I go any further, I just want to just give my perspective on why I'm passionate about it. And some of you've heard this story before, but I always think it's kind of funny, and it's worth listening to it again. I had the great fortune to do media training while serving on the board of directors for the American Association of Critical Care Nurses. I was living in Washington, D.C., and quickly became the go-to person for NPR News, the real NPR News in Washington, D.C., and for meeting with our U.S. legislators on Capitol Hill. I loved every single minute out of that. And I always love to share my bloopers, and Lord knows I've made so many of those through my lifetime. And here's one that I want to share with you that happened with Vice President Al Gore. Now, keep in mind, this was back in 2003. I was just fresh out of my media training with AACN, so I just thought I was kind of full of myself. And I was sitting in the Nashville airport. I did some consultation at Vanderbilt. It was late at night, it was 9 o'clock, and I was waiting to get on one of those, puddle hopper planes, 2-seaters. And all of a sudden I see Vice President Al Gore walking into the gate area. And I just kind of looked at him because I was thinking that can't be him. Surely he would have a, an entourage of security. But, he'd been out of the office for a while. And I think maybe he thought people wouldn't recognize him because he certainly didn't look like that when I saw him in the airport. But anyway, I was just like mesmerized. Oh my gosh, my hands started sweating and I was like, this is my moment. This is my moment. I got to give my pitch. I got to give my pitch. So he got situated in the gate area, and I kid you not, he got his own little private table, and he just started spreading out some materials and started working on things. I thought, well, is that going to be rude of me just to go up? He's doing important work. And so just as I'm getting my, nerve together, I thought, I'm going to go over there and have a conversation with him. And then the gate attendant started saying it's time to load up to get on the shuttle bus to go to the plane. And so boom, he was packing it up quick. So I quickly reached into my briefcase to get a business card. Only had one business card with me. And I thought, well, I'll just sign it and say, thank you, Vice President Al Gore, for all your support for nursing. And that's what I put on it. So I'm standing in line to get on the shuttle bus. Of course, he's the first one in, and he's standing there on the van, little shuttle bus. People are just walking by him, not even acknowledging him. I thought, gosh, that's kind of rude. I get to him, and I put my hand out. It was a nice, firm handshake, and I just smiled. Told him told him who I was, professor of nursing at Georgetown University, and if there's anything the American Association of Critical Care Nurses can do, we're the person to call. So man, I just couldn't believe I got that all out. I gave him my card, knowing he's probably gonna throw it away. And when I sat down, I realized what I had done. And I don't know if you can see it very well, but back in the day, we would put our professional entity on the front and then our board identity for AACN on the back. And I wrote my note on the side that had AACN, and you won't believe what was on the other side. I had my dadgum DEA number. So I didn't get in any trouble, so he probably threw it away. But that's the end of my story. You never know who you're going to see when or where. Have your pitch ready and have some fresh, clean cards with you as well. So here's my other story, and this one was really a pivotal moment for me, and when I actually truly became fired up about working in this area. And I had all my intention was just one mission, one vision, and that was to get Dr. Sanjay Gupta replaced with a nurse as a CNN health news reporter. And I also had this little vision of let's get rid of Dr. Oz show and replace that with a nurse. So the year was 2009, and some of you may remember it was breaking news about routine mammograms for women, showing that there's no evidence to support doing it routinely. At that time, my dean at the Medical College of Georgia served on that national panel, the USPH task force. Absolutely one of the best, most visionary academic nurse leaders ever, way ahead of our times, bold and courageous. But being in front of a camera was not one of her strengths. So when the news hit about the mammograms, Dr. Gupta got on it. So he started, interviewing with all the big top muckety mucks, including the Secretary of Health and Human Services, Dr. Kathleen Sabalis, who basically went out and said, this is from a task force, not the US government. So off he went to start interviewing the task force members. The chair was out of the country, and he saw our dean right down the road in Augusta, Georgia, because as you know, CNN headquarters is in Atlanta. So he called, can I come and interview you? And God love her, she said yes. She always steps up and always says yes. But unfortunately, she was not prepared to be able to handle his barrage. And I mean, it was a barrage of hammering questions. The piece did not reflect well on her as a panel expert. It did not reflect well on our college, and it did not reflect on our nursing profession at large. So my personal journey is to help mentor and develop the next generation of nurses to be lights, camera, and action ready for media opportunities. There's a lot of tricks to make that possible. So here is a whole lineup of talent that we have in our college to tell stories about nursing research and the impact we are making in the lives of individuals and communities. The lessons and strategies we can learn from these can easily be showcased, and we can continue to look at how we can tweak that for media, because oftentimes these researchers are the ones that are called to be on the hot seat. They can be the voice of their work and the direction they're going in. You all might remember Dr. Deborah Mosher testified in front of U.S. legislators on the impact of PCORI funding. Dr. Kristen Ashford out there in front of legislators and cameras all over the place for maternal child health outcomes with moms struggling with addiction. And Dr. Lavora Williams and all of her work with health disparities research, and even her recent COVID work in the Black communities. Then we have a whole lineup of talent for scholarly practice media opportunities. Dr. Sheila Melander has been the queen of podcasts for NP regulation and practice, as well as being in the hot seat in front of legislators as the national voice of the president of the National Organization NP faculty. Julie Marfell, Dr. Julie Marfell, A++ for all the YouTube clips that she has when she was the dean at Frontier Nursing. And now she's ramping up with podcasts and webinars about the Kentucky nursing workforce research that she's doing. And we all know Dr. Sharon Locke, another outstanding spokesperson in front of the camera about NP practice. And if you pull her up on YouTube, you'll see some A+ performances by her as well. So we have a lot that we can learn from our colleagues in our own college, and even from our students and our alumni. So Kara Brado is featured in the Engagement magazine. She had zero media training, but oh my goodness, read her story in the Engagement and you'll see how powerful her voice is. Dr. Eva Stone came to our DNP program strong and continues to be the voice with legislators in Kentucky for getting our public schools equipped with more nurses. And I just have to tell you that Dr. Camille Burnett is a magnet. I don't think she sleeps, but she is always ready to do podcasts or interviews to advance health equity in the Commonwealth and beyond. And I have to go out there and say, there is no one that I know of in our college that has been battle tested more than Dr. Ellen Hahn. It's been the good, the bad, and the ugly journey. As you all know, she did that because she was doing the right thing. And as much as it broke my heart and as scary it is, I just could not believe when I heard the number of death threats, lawsuits, and even being called to the main office, the president's office, for her voicing up to protect the health of others through tobacco control policy. She is the go-to person for lung health advocacy, with a strong following of her team members that are working on her legacy as well, to be that voice for lung health. So in closing, I hope you'll be excited about some of this for us perhaps to come together for a media making mission. Diana Mason may have made the jump start for us, but we have a lot of talent right here. And I believe a lot of our faculty and staff and definitely students would be interested in advancing their professional career through public media scholarship development and build something really special for our college. Similar to what Rich Hart Summer Writing Institute has done. How cool would it be if we started something like a Media Making Summer Institute? So in closing, I thought it was fitting to end with a quote in honor of Dr. Pat Howard's retirement. And thank you, Tricia, for including this quote in your slide presentation. A bird sitting on a tree is never afraid of the branch breaking because its trust is not in the branch, but in its own wings. So I thank everyone for being here today. Happy New Year. Keep your Big Blue Nursing Nation wings strong, and keep your news channel tuned to one thing, and that's WKY Hopeful. I made that up. I think that's pretty cute. All right, how am I doing on time, Julie?
You are almost 15 minutes ahead. We have 13 minutes.
Okay, well, why don't you tell me what kind of questions popped up? and I'll be glad to take some questions, and I'll go ahead and stop sharing this so I can see you guys, because I can't see you when I'm sharing.
I am not seeing questions in the chat. There's a comment from Melanie about supporting the Institute, the Summer Institute. Does anyone have any questions? If you do, you can write them in the chat. I have a question about the Institute, Janie.
Okay.
So how is this going to be different from the one, this past year?
Okay, it's a great question. Thank you. I just called it an institute because I love the work that came out of the Rich Hart Scientific Writing Institute.
Okay.
I mean, they have that's a well-oiled machine, and I think we could learn a lot from that. And they were very intentional about when that takes place, how it takes place, the cost of it. But more importantly to me is what came out of that. I mean, it's, right here, I've got, many of you on this Zoom call right now have benefited from that program with your publications. So what would it be like if we did something like that in the summer, where we would do an intensivist type experience, perhaps? Maybe it would be more ongoing, so that we might develop it like a fellowship where you have some intensivist type training, and then you've got your deliverables or some outcomes that would be expected for you to be working on throughout the year, working closely with experts in the field. And I would be very open to thinking about it. Would it be something that faculty and staff would apply for? And I do know that we would have donor interest, and I do believe it would be wise of us to set it up in that kind of a platform or model where those that are interested in committing, and that's the thing, you've got to commit to the time and to walk into that space fully aware of what's expected. Commit to the time, obviously have support of your associate dean for doing that work. And perhaps it would be an essay type application, and there would be a selection committee that would look at individuals, because it is possible that, there would be limited funding to be able to do it. So we'd have to start small, I would think. But then I really think, Julie and Camille have got this down. So if they have that integrated in that one course, they're going to keep doing it in that course or some version of it. Why can't we look at also doing it for our PhD students and our undergraduate students? So there's lots of possibilities on what that might look like.
Thank you.
Everybody must be waiting to hear from Dr. Terry Lenny. He doesn't even have a bow tie on today. They want to hear about accreditation.
We do have 10 minutes. Do we want to take a quick break and then come back for the accreditation talk, or are there any questions for Janie? If y'all just want to unmute yourselves, that's fine too. Okay, so let's take a quick break and be back by 11 for the accreditation part of the retreat.
Thank you guys very much. I appreciate your time. You know how to reach me if anything pops up on your mind or you have some questions. And for our guests that have joined us, once again, we've got a morning session that may be kind of a ho-hummer, but maybe you liked what I just said. I don't know. Next up is accreditation. And then at 12:30 is when our keynote speaker will be here, that I know you'll want to be engaged with. So you're welcome to stay and listen to our accreditation presentation, because actually some of you will probably be on the agenda to meet with our site visitors. So I'm looking right now at Carlos and Jim and Monica. So you guys are welcome to stay. So thank you.
Well, it is 11. So we want to go on with the accreditation. Doctors Terry Lenny and Evelyn Parrish are going to give us an overview of accreditation. So I'm calling this Accreditation 101. And, I was looking to see if Hartley Feld was back, to see if she wanted to give us an update on the needs for vaccination. And
Julie, this is Kristen. She's on the UK healthcare call currently right now, so she'll hopefully be able to do that a bit later.
okay, cool. Thank you. Okay, so Dr. Linney and Dr. Parrish, you have the floor.
Okay, thank you. I am going to share a screen. I just was listening to the deans talk about this media training, and I thought maybe we could do that to talk about accreditation exciting, because I don't know that it's all that exciting or compelling, but it is extremely important. So I hope that you will appreciate that. I'm going to share my screen right now. So hello, everyone. So Evelyn and I are going to go over just an overview of CCNE. What we're going to do is just tell you where we're at with it and what we expect is going to happen going forward. And the dean had tasked us, and you're going to see, you'll recognize, because the dean actually drafted these slides originally, and we've changed them since then. But you're going to see her voice in here. I know you'll recognize it when you do. So.
Harry, that wasn't very nice.
No, it was a good thing. I'm just saying your voice is in here and people will be able to recognize it. And I mean that in a good way. And they'll see it. So that's not a bad thing. It's just saying your voice is here too. So anyway, so we're going to do this. I'm going to go through this, but as you know, Evelyn's been the key person has been key in drafting our self-study, and she's also a site visitor, so she's going to be invited to speak up and add whenever she can, but she is also going to cover a few of these slides as we go forward. So this is just to set the stage for where we are at now and to develop a framework for what's going to happen as we move forward. I also would have a caveat that at one point we had planned to do some interactive work here, but because nobody's seen the actual document yet, that's not going to happen. So we probably won't take this full hour, which means we'll all get a little bit of a longer lunch. So having said that, let me just give you an overview of what it is. So first of all, why is accreditation important? And this is probably, I think we all know that technically accreditation is a college. It's not mandated. It's a choice to do this, but in the end, you really don't have a choice because you essentially have to do it in order to survive. But here's what it is. Here's why accreditation by CCNE is important. This is what CCNE, when they do their reviews, this is what they're looking for, what their plan is, and that's to hold nursing programs accountable to the community of interest, which is, as you can see, it's the nursing profession, consumers, employers, the institutions of higher learning, so our actual university here, students and their families, the nurse residents, and to one another by ensuring that the program's mission statements, goals, and outcomes that are appropriate to prepare the individuals to fill their expected roles. So do we have those? Are those really there to fulfill the roles expected of those? And then once we say we have those, do we actually do it? And so that's also to evaluate the success of the program in achieving these mission goals and outcomes, to assess the extent to which the nursing program meets accreditation standards, and then to tell the public the purposes and values of all of this as well. And then to foster continuing improvement in nursing programs and thereby in professional practice. And that's really, these self-studies are really very informative in knowing and telling us where we are, but telling us in places where we can improve as we go forward. And so this is it. So accreditation is important because it does this. It really is a marker of quality of the program. Here's what would happen if we lost the accreditation or when people lose the accreditation. And that's part of this is that communities of interest of all. So students are likely not to enroll in a program that's not accredited, and that's pretty clear why, because they're not convinced the quality of the education they receive might be questionable. Their ability to transfer to another program may not be possible because accredited programs are not likely to take credits from not accredited programs. So that's really there. The other thing is even though that the Department of Education and most state funding agencies will not fund students who are enrolled in non-accredited programs as well. And employers, as you know, employers look at accreditation as a mark of quality of the students that they're going to receive when they're graduated, and so they're not likely to employ them as well. And the university is not likely to endorse a program and maintain a program that isn't accredited. So it's important that we maintain our accreditation, of course. So a little more background. So the last time we did this review of what were improved was in 2012. And now we're up for the review this year as well. And all our programs are going to be accredited at the same time here. So this is a pretty large review as we go forward. Yes.
If you change your share view, which monitor you're sharing, we can see this a little bit bigger. We can see what you're seeing actually, and not just the slide you're showing. Can you? And so it's not quite as big.
All right. Well, let me see what I can do. Because for me, it's big. So I see it on my whole screen. So that's okay.
So it might be just sharing the screen, the monitor that you're seeing.
Well, I can switch monitors. How's that? Let me try it. I'll change. I'll move over here and see if this works better for you all. Otherwise,
it's just not. We're seeing both slides. The one you're seeing.
Oh, I know how to fix that. Oh, I'm sorry. I know how to, hold on. All right, let me do it again.
You might need to stop share and then.
Yeah. It's the screen. Okay, let me move it over here. Let me see now. Apologize,
It's a nice
everyone.
little commercial break for Rich Hart Research.
Okay. I'm gonna make Zoom big so I can look at all the controls here.
Right.
This is, you know what happened here when I came in today, it switched and my primary screen is actually my smaller screen and I couldn't get it back. And now, hold on. Technical.
You know that only happens when you have a presentation to do.
Of course, that's it. So I got that. So I almost have this.
Right now, we're seeing your screen with Teams on it.
With what on it?
Teams.
Okay, so I can't, wow, this has never happened. So I can't find my stop screens button because it disappeared.
So there you go.
Oh, there, thank you.
We are such a kind, patient group.
I know, and we all appreciate that.
And you know, this is probably going to happen during the site.
Thank you all. That's why.
Let's pray we have some kind, gentle reviewers that don't get irritated with us.
Yes.
Because this has happened to all of us.
Yes.
Okay. So tell me now if I share this screen, is it better?
Yes.
Is that working?
Yeah, we can see your big slide and then your
great.
lineup. Yeah,
All right, so thank you for that, Julie. Let me
that was
just,
Ms. Soap's comment.
is that all good now?
Perfect.
Okay, good. So thanks for that.
Okay.
Okay, so let me just back up so I know where we are. So, because I lost a couple. So we did this last one, and so we're doing this one. As I said, all our programs are going to be reviewed at the same time. So that's a large task for them as well as us. So the self-study submission and the public notification of the submission will be on the 25th, as Dean Heath said. That notification will be posted on our College of Nursing web main page as well. And there's also that at that point, we invite third parties to comment on the accreditation. So we collect those comments as well. We will put the full document there for you to see underneath the accreditation tab, which is in our About Us piece on the main stages, on the main page as well, for you to have it there. And as the Dean said, the virtual site visits will be from the 24th through the 26th of March as well. We would also like to thank people who've, oh, this is a double thing, hold on. There, so I would like to thank the key contributors to this as well, which is, as we said, Dr. Parrish was a key person in writing this as well. Lisa Jackson and Tricia McCullough have been key in that as well. The Dean as well has been a big active contributor to this. Academic Student Affairs, Karen Butler, Joanne Davis, Kathy Collins. We have from the BSN, we have Drs. Ashford and Welsh and Melissa Miller, and for the MSN, DMP, and post-certificate programs, Dr. Melander and Dr. Hampton and Patty Foster. Dr. Dent's been good with the Simulation Center, and we have Kara Mitten and Christy Henson as well. I got this out of my way there, thanks. And Cynthia Fintress, and then Dr. Kelly and Brett McCourt and Scott Calvert is for helping do that. We also have had a number of people already review this and give us feedback. And so that was all the associate and assistant deans, as well as myself and the dean. Faculty council has provided feedback. Staff council has looked at it and given us feedback. We also sent that to key UK healthcare leadership across the hall, so across the street. So Kathy Isaacs has done that and given us feedback. Patty Hughes has done a really great job in giving us a lot of good feedback for that as well. And Gwen Moreland has also been looking at it. So we've had a lot of good feedback already, and we're in the process of revising it based on that feedback. The virtual site visit, I'm going to let Evelyn take over and describe this because she has a better understanding of this than I do. So Evelyn.
Thank you. So since we're doing all of the programs, we most likely will have 5 site evaluators, and there will be representatives from academia, practice, both hospital and NP practice, and possibly a community person will be here. We're not sure yet the exact composition. The timeline for the team to review the document and access the website. So the document will be available to them 6 weeks prior to the visit. And then we will make the resource room available to them 2 weeks before the visit. And that's a change for virtual versus if it were in person, they would not have access, obviously, to the resource room until they got here. So I think that, in my mind, that's a good thing for the team to go ahead and see what's there, what they need, so they can be very directive, if you will, when they come to do the visit. So, Dr. Lenny?
Oh.
Okay, so the plan, the anticipated agenda with meetings, these will all be held virtually. So the team will meet with the dean, also with the college leadership. They'll meet with the BSN program faculty and staff, as well as the MSN DMP certificate faculty and staff. They'll also typically want to meet with students in all of our programs. Possibly they'll want to visit with the clinical instructors / preceptors. So, you know, if they were here, they would go to the hospital, obviously, or to the clinic and visit at that time. So we've gotten some feedback from other places that have had visits this year. And so we're still trying to work that out. But I think that the best is going to be the clinical instructors that have a group of students, and that will be held virtually to kind of review their clinical. And then for the DNP MSN certificate, they'll meet with the student and preceptor virtually. And they also typically want to attend a course in each of the programs. So once we know for sure what the team request is, then I'll be reaching out to the assistant and associate deans of the respective programs to identify the clinical group, preceptor and faculty, or excuse me, preceptor and student, and also the course. So if y'all want to start thinking about that now, I think that would, you know, be something fun to do in your spare time. Also, possibly faculty council and or faculty at large. They'll want to meet with our communities of interest, and that will include our clinical partners, university leadership, our community partners, the dean's advisory boards, alumni association, all of our folks in our community of interest. They'll also want to talk with the provost and perhaps the president if he's available. And then at the end of the visit, they will meet with the dean to review their, I guess, what they will say is that we either met the key element, standard and key element, or they found a compliance concern with one of the two. And they will share that information with her prior to meeting with the college at large to give that report. So Lisa Jackson and Jesse and I have been meeting, and Jesse's developed our CC&E virtual resource room on Canvas. And so each, what's now we know as a module, we're changing that to the standard, like standard 1 with the title. And then in that module, we'll have each key element listed separately. And then within each key element, we will have all of the exemplars that you all have submitted for each of the key elements to further exemplify the work we're doing in the college. The other thing that we will be doing is creating a video for the team on how to use the virtual resource room, where to find stuff. We're also including a video of the university, a tour of the university, a video of the college, and we're in process of getting a video of UK Healthcare to share with them, because they want to know, you know, what this place looks like, if you will. And so we'll get that going. It'll be loaded into the virtual resource room as well. And Dr. Lenny? Okay.
Okay, we just going to just go through this, the standards just briefly here to do this. But so there are the 4. There's an introduction and overview of the university. Then there's standard 1, which is all about elements of program quality and the mission and the governments and the values of the. And there are on that there are 8 elements that are addressed, and they're addressed for all those programs: BSN, MSN, DMP, and postgraduate certificates. All have to address all of those elements. Then standard 2 is program quality, institutional commitment, and the resources that we provide for this. And there are 6 elements of those that have to be addressed by all of those programs. Standard 3 then is program quality related to curriculum, teaching, learning, and practice. And there are 9 elements in there that have to be addressed by all those programs. And then standard 4 is program effectiveness. So it's our achievement and outcome, program outcomes. And within there are 10 elements that have to be addressed by all of these programs as well. To date, we're getting not fully completed, but we're getting close to completion. There are a total of 72 pages addressing those elements, plus an additional 90 pages of appendices. And keep in mind, this does not include the entire virtual resource room that they will also have. So it's a tremendous large amount of stuff to compile and put together in a way that's cogent and that is organized according to these standards. So it's been a big task so far. So the dean had challenged us with just the team with going through all of this and just going by the standard program and say, here's the program 1, and then asking on a scale of 1 to 5 with highest confidence success where we believe we are in the college with all of these elements. So as you can see, where we are with standard 1 with program quality, mission, and governments, those 8 elements addressed by all those. If we did it on a scale of 1 to 5 with confidence of success, meaning that we will meet that standard, we've given that a 5, which means we're highly confident that we're going to meet that standard, that we have all the elements there. We have all the evidence to support all those elements as well. In our external review, the people who have already reviewed this, most of them, none of them have said that we're missing evidence to support those elements. They've had other comments in there, but none of them have said that you don't have the evidence to support that you've actually meet this standard. So right now, our level of confidence, I don't think we're overconfident, because I think we're doing a really good job with this, is that we're highly confident that we will succeed and meet this standard. Here are some of the strengths and opportunities. And again, these are early, but these are ones that people who have reviewed have been identified as strengths and opportunities for improvement, rating that standard. And you can see it's the number of faculty who are participating in governance in the College of Nursing and in the university. It's student participation in program governance. The way our website is laid out, the navigation is easy and it's always being improved there. The advisory boards that we have and the number of outside supporters, the student resources that we have for them, and other resources that are here and on campus, such as mental health and other things that we have. One of the opportunities for improvement that was identified was there are some caveats about course intensity, number of students, and number of students. So there's just somewhere that we have to be a little more transparent in how that's presented. Evelyn, did you want to say anything else about that?
I think that I have beefed that up just a bit in the self-study to further identify the DOE process and how it's based on credit hour. Like for psych, we have 3 students and it's a 2 credit hour course. I'm not going to get, the same DOE time for that as an undergraduate 3 credit hour course with 100 students would. So I think that I have, hopefully you all will read it again, Dr. Linney and others, have clarified that and made it more transparent how we're doing that.
Okay, great, thanks.
Mhm.
So standard 2, which again is program quality related to institutional commitment and resources, and those 6 elements there, again, on a scale of 1 to 5, we believe that we have enough, that we meet all those elements and that we have the evidence to support that we meet those elements. So we're highly confident that we will also meet this standard when they come to review. These are just a few of the strengths and opportunities. And again, we don't have a large number of these. These are the ones that people, these are the ones that people did. But they said that the College of Nursing has access and contacts to all of the hospitals in Fayette County, which is good for student placement. It's a laborious process, but we've been able to assure clinical placements for all our students each semester, which I think is, that is big. The other thing that the opportunity for improvement that's been identified is that we have to make sure, and things have changed so much this past year with people working from home and remotely, making sure that everyone has adequate resources to work from their designated location. That's been one of the things that was an opportunity for us to improve. Okay, standard 3, which was program quality related to curriculum, teaching, learning, and practice, and there are those 9 elements there. Where again, we believe that we will meet that element, that we're highly confident that we have the evidence to support that we meet all those elements in there. But that 5 is there, we're confident, but we're not totally, we don't have all the elements and exemplars and key elements there yet, but we're confident that we will have them before we submit. So that one also, we're there. We also are fairly qualified. We don't have any really, nobody's identified any strengths or opportunities in this one yet because it was still kind of being finalized. Okay, then standard 4, which is program effectiveness, and this is assessment and achievement of program outcomes. There's 10 elements there to address. And on a scale of 1 to 5, we believe we're at a 4 here with meeting that. So we're confident, but we're confident, but not highly confident. And here's some of the discussion related to that. Okay, so standard 4, some of the strengths that were there, we have strong rates of program completion, as we know. We have our NCLEX pass rates are enviable. And so we have very good certification pass rates as well. The aggregate faculty outcomes are good. And the mechanism for receiving course evaluation data and the use of TCEs is there. Our graduation rates greatly exceed the CCNE benchmarks of 70%. And our employment rates, and again, it's for the students who have responded, exceeds the CCNE benchmark. And they also, people commented on the strength of the Dean's Advisory Board as well. Opportunities for improvement. This, and we struggle with this all the time, but we have low student response rate to surveys is there. So it's getting the data to show that we actually are meeting these elements is the challenge for us as well. They also, reviewers have noted that there was a recent decrease in faculty scholarly productivity. So I think we have to look into that and understand what's going on there. And also the low response rate to alumni surveys. So the problem here is getting the data, at least the response rates there for the students and the alumni, to show that we have as additional evidence to support that we are meeting this standard as well. Anything, did you have any other comments, Evelyn?
On this, the opportunities for improvement, a couple of things. One, the alumni surveys, Dean Heath and I spoke about that. I think we're going to kind of revamp that process so that we're collecting data more than one time. We'll do a 6-month or a year or whatever. And so that we will be working on that at some point. And the recent decrease in faculty scholarly productivity, I wanted to just say that, yes, while there's a decrease, I've explained, and I think those that read it, could tell that I've explained that the faculty scholarship or scholarly productivity is directly linked to the percentage of time in their DOE. Okay, and so I've got a table in there that outlines what the percentage is and you know, for each of the title series. And so I think, you know, while we said we're a 4 and we're pretty confident, I feel okay on the lower end of okay, that they're going to be fine with that explanation, and that we have had an increase in the need for teaching of faculty. And so the scholarship has gone down just a bit, or that time has gone down, but that's reflected in the document. The low student response rate, you know, that's something that everyone struggles with. And I think that one of the things that you know, I send that information out to the associate and assistant dean stating the end of program survey has launched, or the TCEs have launched, or whatever. And you all have done really good with reminding students to complete that. I know there's a lot of discussion about, you know, we don't incentivize or can't incentivize our students anymore, and that's why we're getting a low response rate. But I think you know, that's an area that all of us are going to have to come together and figure out how can we message this or talk with our students about the importance of it, because their input into program improvement and our program outcomes is crucial, as Dr. Lenny had mentioned before. That we've got to bump that up.
Okay,
Thank
thanks.
you.
So here's our next steps. And some of this the dean mentioned earlier, but the all hands on deck. We all are going to have a role. We're looking at developing some mock sessions for CC and ICS success. Those sessions would be, if we can, well, I'm not going to identify names. We have some people in mind to do this, but they haven't committed yet. So sessions with some experienced reviewers, and those would be, at least some of these sessions would be with the BSN faculty leads and the staff, the DNP faculty leads and the staff, faculty council and others as well, in those mock sessions. And ideally, if we can get we have a person that we think would be very good at doing this, somebody who's an expert in accreditation, because we'd also love to do a mock review of looking at the documents and then trying to navigate the virtual resource room as well to see how that works. So somebody to come in from outside and do that, which I think would be really helpful. And then also, while doing all that, any questions that arise or questions or concerns that arise while doing that as well. So that would be a different type of mock review, but I think one that would be very important for us to do, because I'm sure nothing could be more frustrating than reviewers when none of this works, or you don't find what you need when you think it's going to be there. But I also think we're doing with the help of Jesse, that virtual resource room is probably going to be really very well organized as well. Okay. So each of us needs to commit to do our part. So we all have to be familiar with the self-study. It's a large document, but you should be familiar with it as well. And as the dean said here, know thy college, thy history, the vision, and the key initiatives as well. Make sure you review your CV for accuracy. I know you're being asked to do that now. Make sure the websites and unit areas around you are accurate and complete. And I know people are asking for that as well. To again, review your faculty and staff directory and websites for accuracy and completeness as well. And when they come forward, please engage in any of these sessions you can in the reviews to help us get prepared for this as it comes forward as well. And this is just some questions that we were going to do. We're just going to throw them out here now, just so you get an idea of some of the things you might want to start thinking about. And these will come out once we can post these for you to start thinking about when you review this as well, but just to get you thinking in that way. Sandra, what would you do if the team asked you, how do you contribute to the mission? And the dean's given us a nice little lifeline to help you think about where to go to find that. How did the college come up with its values? And can you share an example of those? As well, and what is the one governance or issue or initiative that you are proud of, and one challenge related to governance that you'd like to see improved? I think these are great questions to think about, and places where you can think about them as well. And we'll share these with you, but I just wanted to give you an idea even things that you want to start thinking about. Standard 2 is how has the college managed the budget constraints? And can you share how you or the unit have contributed to making a difference in that standard, and where you can go for that information? How does the university support the college in terms of new programming and initiatives? And can you share an example of support, a request, or a unit that you were involved in? And what is one initiative related to meeting the budget that you are proud of, and one challenge related to the budget that you'd like to see improved? And again, hints where you can find that. Okay, then how have your unit contributed to program and curriculum changes? And can you share an example how you did that for Standard 3? And what are some of the data sources or venues in the college to know the needed changes and to make with the curriculum? And can you share an example of data, a resource for curriculum change? So it's this idea of, do you know where to find all this information? And what is, again, one initiative related to curriculum change that you are proud of, and one challenge related to curriculum that you would like to see improved? This is all about self-reflection too, as we go forward. And this is it. How would you, for Standard 4, how you or your unit have contributed to the program effectiveness outcomes? And can you share an example mentioned in the self-study for Standard 4? And what are some of the data sources and venues in the college to know about for program effectiveness and faculty outcome? And can you share an example of outcomes that was described in the self-study? So it's nice for you to be familiar where that is and have one in mind as well. And again, what is one initiative related to the evidence of program effectiveness that you are proud of, and one challenge related to program effectiveness that you would like to see improved? So I think these are great thought-provoking questions that you can, that we will also send out, so they'll be there with the self-study for you to start thinking about. And I certainly appreciate the Dean for showing us these lifelines to help us find where we can think about that information as well. So that's our overview. And we invite questions, but I know Dean Heath, this final slide was yours for additional thoughts as well.
Can I interject something before?
Yes, oh, please do.
The team may ask the students, how is your program developed? You know, what's it based on? So, you know, the essentials is the right answer, right? The BSN or MSN or DNP essentials.
Evelyn, that's what we need is the answers. on
Yes,
our
well, that's what
FAQ. We want that really in large font, we want that widely disseminated answers.
And I think, you know, for the NPs, we also do the NOF and the NTF criteria or AONE or whatever, but we need to make sure that our students are getting that message. I was on a visit once and we had met with the students, but a student wasn't able to be there and he really wanted to talk with us. So he came in and one of the visitors asked him that question, what, you know, how was your program developed? What did the faculty base this on? And he said, oh, I don't know. I think they're just smart people and they just decided what we needed to know. Well, that was not the right answer, but we finally got him around to, you know, what needed to be said. So, you know, I'm happy to help in any way that I can with your students or whatever to make sure that you feel comfortable, that they are prepared, if you will, for the visit. Just let me know what you would like, but we do need to make sure that we're prepping them. I don't know that they need to read the self-study. If they wanted to, certainly that would be helpful. I think maybe some of our leadership students might like to do that or something. But anyway, I'll leave that to you all. You just please reach out to me and let me know what you need from me. Thank you.
So that's nice, Evelyn. So maybe we can help do something like this for the faculty with their students, so they can help prep them for what to do as well. I think that's a good point. So thanks for that. So Dean Heath, do you want to have some final comments?
Yeah, thank you so much. And I hope that you and Evelyn get a chance to look at the comments in the chat boxes. You know, there is widespread recognition of how massive this is. And the work that's gone into it is greatly appreciated and being recognized. So I want to just make 4 comments if I can. First of all, I'm with you, Susie Pilon. Bring on those cliff notes, and I think everybody else would appreciate them as well. But I want to just remind everybody, just like we do with Joint Commission, you know, the operations still have to move forward. The mission of the college will continue during the site visit. And although we're going to do our very best to work around a schedule that accommodates those that are absolutely essential for the team to meet with, we do want you to just be very sensitive once we have that agenda nailed down, that you'll look real carefully at what your life looks like on those 3 days in terms of teaching responsibilities, clinical with your students, research or practice, because it may be that there will be enough time. I'm very confident that we'll have enough time so that you can get some coverage for that. So with that, as soon as we know that, I know that Evelyn and Terry will get that information to us, as well as, and we've got time and we will cover other areas during our faculty organization meetings that we have before the site team gets here. But it's real important that we know the team. And I can just tell you that, you know, Evelyn's been around the block a long time, and she is a very compassionate and great lead for those teams. Not all team leads are like an Evelyn Parrish. They're not. They can be wicked. So we're going to just say our prayers that we have a great team, but we're certainly going to research them up and have a good feel for where we think they might be coming from in terms of their perspective. So that's one thing that I wanted to share. The second thing is, you know, if anyone went down and we didn't have all of our, you know, COVID restrictions going on, and they just took Terry Linney's pulse or Evelyn Parrish's pulse, or just felt the palms of their hands, you know, there's a lot of pressure on them. And I can just tell you this, it comes from, oh my goodness, you know, when you have a dean that spent 15 years of her academic nursing career as the academic dean. I've done a few of these. So, you know, I have put it totally in their hands, but they know I'm a critical eye, and I'm going to look and I'm going to question. And I think that we've had a good partnership about that. But now, Evelyn, I'm going to get back into that table of yours. And you all know no one's going to mess with my college. And Terry's main job is to keep me under control when the team is here. If they start going down a path I don't want them going down, he's going to have to keep me under control. Because our faculty scholarship, a lot of that is your interpretation of that data. And I know for a fact that that's an area that I've always felt like we could improve in, that we do not capture things like how many times we submit a grant, how many times we submit an abstract, how many times we submit an article for review, presentation. That's productivity. You know, you hear all the time Tom Kelly talk about the researchers and what a productive team we are. It doesn't mean they nail every single grant, but oh my God, they're cranking it out. So same with us. You know, I know that we have faculty here that have been, you know, hammering away to get abstracts accepted, whether it's for podium or posters, to get their manuscripts accepted. That should be counting some way. And I think we have a real opportunity to look at that. So I'm gonna go back there and look at that table, Evelyn.
Yes, and can I interject something, Dean Heath?
Please.
The information that we obtained for that scholarship, presentations, abstracts, book chapters, publications, posters, whatever, comes from the faculty's CV. That's the only way we have of collecting that data. So I would welcome you to look at my table.
Well, and that's to your point. I bet if any, I don't know of very many that go out there. We do all the time in review. So for our, I think we are doing pretty good with our manuscripts that are under review, book chapters under review, or in press. We've got to make sure we count that. But I really think that we haven't been capturing things like submit. I think the researchers are good, and we just need to make sure we go back and look at that. Those grants that were not funded, you know, that's productivity, you know, that's productivity. And I know we can't go back and augment now, but moving forward, I see it as an opportunity for us to start in our CVs capturing that you submitted 20 million abstracts to wherever, SCCM, AACM, NOMPF, you know, because I know it's being done. We just don't nail them every time. So enough of that. I'm just butting you around, but you know, I'm gonna look at it.
Well, of course, and if you're math, you know, I'm old school math, so you may be doing the new math. And if
Yeah,
your new math comes
whatever
up
makes
with-
us look good. That's the kind of math I do.
Just
That's the
saying,
kind
you
of
know,
math I do.
so-
Okay, my last two comments. Did y'all see my slide up there with Ruth?
Oh. I'll do it.
You took my slide down. I like her. My point with this is that, you know, this is not a time to judge at all. It really is not. I look at it as a really great opportunity when colleges go through accreditation, because it really helps us look at ourselves and for us to be able to say, wow, there's lots of opportunity here where we can get to a better place. And that's what, you know, a really good, solid team is all about, is to help you recognize some areas where you've got some opportunities for improvement, because there is not any, you bring it on, program of study out there, nursing program of study that is like 100% perfect. And I think there's several that come pretty darn close, and I put us right up there. So I just want you all to know that. There have been some occasions where there's kind of been the good, the bad, and the ugly with the journey, and that's not us. That's not what we're about. And I always remind our constituents at large when we post the announcement that the assessment has been submitted, you can submit your comments to CCNE. I always say that, you know, gosh, you know, don't throw us under the bus. If you're getting ready to throw us under the bus, let me know. Let me hear about it first, so that there's just not any surprises. And it is what it is. And I feel very, very good that our community at large will, if they do submit comments, it'll be positive. And I just encourage you just to remind colleagues that you come across that we really appreciate you letting us know concerns before the CCNE site says, well, we got a dissertation about, you know, that never makes the dean feel real good. The other thing I want to bring to your attention, you know, that everyone knows how tight it is with budgets, and that's not the purpose of accreditation. They really are looking at the quality of your programming. So, you know, I've known some colleagues that just went out there and they just wind up a big storm, or they complained up a big mess in their self-study about their woes with the state funding. These are smart people, and they see those dollars, and they see what it was before, and they see what it is now. So they know the struggles, but they're interested in how did we react to that? How were we able to continue to do such a great job with our programming and our faculty and student outcomes? So those were my final comments I wanted to say, other than, again, I appreciate all the work that the prime real estate on that second floor they've been doing. It's been really amazing, and we've got a little bit more work to do, but we're close to crossing that finish line, and I feel really good. The last thing, I did talk to my SEC deans, the two that went through a virtual site visit, Vanderbilt and University of Florida. Vanderbilt, they are golden. They passed, or feel like they pretty much, you know, the team's not going to come out and say you passed. Only the board can say that. But they met every standard in their sign off. And University of Florida, that dean didn't come right out and say that things were real good with them. But let me tell you what they both said. Know how to navigate and access that resource area very, very well. Let your teams know in advance how to access and how to navigate. So they really did stress the importance of having the stability in that platform, and for the CCNE site team to know 1, 2, 3, here's how you access this. This is where you find that in advance of the site visit. So, and lucky us, one of our PhD alums is the senior academic dean at Vanderbilt, and more than gracious to share the experience with us, and we're looking forward to hearing from her so we can nail it, and we will. That's all I have to say. Other than I'm looking at Vicki Hensley, it looks like she's doing a dance routine or something, or maybe I've got a little bit of something crazy going on with my computer here. That's good, Vicki. It's part of her resiliency practice.
Okay, thank you all. We did have one, or are there any questions for Terry, for Dr. Lenny and Dr. Parrish about accreditation?
I have just a comment. It's a large amount of work, and I say kudos to Dr. Terry and Evelyn for guiding us in this process. It's much appreciated. I think being on faculty council and reading through some of the documents gives us an impression of just how much work you've put into it. So thank you.
It's like an R01, right? I mean, it's beyond a dissertation. It's like, I'm putting it up there with an R1. Can I say that, Zim?
So speaking of looking at it, do you guys have a tentative timeline about when the full document might go out to faculty?
I think we had down the 25th, right? Isn't it
Yeah.
that?
Yes.
So when it goes out, public review, it can go up to the faculty on the 25th.
Okay, gotcha. Any other questions? There's kudos for y'all in the chat box if you want to.
Appreciate that.
Mhm.
Yes,
Very
and
nice.
Evelyn gets the bulk of the credit because she's really worked the most on this, so.
Do we have the table that we're talking about, the scholarship table that was discussed? I think that was in which standard is that in? And well, I don't
Can you
know.
Standard.
ask that? I'm sorry, I didn't hear what you said.
The table about scholarship, where is that?
It's in standard 4, under aggregate faculty outcomes, which is key element H.
So do they want to see it ahead of time, or they'll see it when it comes out on the 25th?
Yeah, we'll see it when it comes out. Melanie has access because she's on faculty
Oh, well, then
council.
yes,
So
absolutely.
let me just say that, Melanie, the data that you have, I'm not sure. So, there was one we sent out before Christmas, and there was stuff that needed to be addressed. That was one of them. And then there was another one I sent out after Christmas for those that didn't have an opportunity to look. So just, if you want to email me or whatever, make sure you've got the right table that you're looking at.
She said she found it.
Okay, thank
Okay,
you.
got it. Okay. Thanks,
Um,
everyone.
Yeah, thank you all. And Dr. Ashford, well, let me just say too, briefly, faculty council is planning on helping people learn more about this document through either faculty org, as Dean Heath mentioned, or some weekly, throwing out some weekly questions, much like you saw on those slides there. So we'll keep up the information channels so we all can learn what we need to know. Okay, so Dr. Ashford mentioned you have an update from Hartley?
Yes, thank you so much, Julie. As Dean Heath mentioned, we have a real opportunity to make a difference for the immunization fair and campaign that's going on. UK Healthcare was contacted by the state to really be actually a public health outpost. That's going to happen at Kroger Field. And Hartley has been engaged in many levels as other faculty here. I'm probably forgetting some. So she wanted me to let you know that beginning February 1st, UK College of Nursing has been asked to provide 20 spots every day, Monday through Friday, and 10 on Saturday throughout the month of February to fill spots to provide immunizations. The requirement is the person has to have a CPR. That's the primary requirement. And as well, what she also wanted to know was that there are also opportunities for staff to get engaged to help with registration and those pieces. Retired faculty can also be engaged. Although our official start for our College of Nursing campaign doesn't start until February 1st, they're beginning it campus-wide and university-wide earlier. So Hartley will be sending out opportunities for us to even volunteer individually if we would like before February 1st. I would really encourage any clinical instructors or anybody that wants more information about this and how to get engaged to join us for a Zoom at 3 today. We really are needing clinical instructors to bring groups of students and sign up for those dates. We really want to have a really strong presence. And again, in theme of this media, I think we can make a real difference. Any questions?
Will you all be sending out a Zoom link or an email with this info?
Yes, we'll send an updated one. I believe Melissa did send it to the undergraduate faculty already. So if we want to send it to all faculty and staff, Melissa, I'm sure would be happy to.
That would
And
be
Kristen,
great.
if I could just add, for those of you who haven't gone yet for your COVID vaccination, you know, there really are opportunities for our staff, because staff are the ones that are being utilized for the data entry, for logging in the number of the vaccine lot and that type of thing that has to be reported to CDC. So, you know, staff, feel free to see if this might be something you might be able to help support as well.
And Kristen, I don't know if you can see that chat, but Dr. LaVoy Williams said to count her in, but she can't come today.
Absolutely. There'll be lots of opportunities. Hartley will be sending up some other signups, but to talk about getting your students engaged and making sure that we have a strong presence for filling in that February calendar, might be helpful to have some discussion today at 3 so we can hit the ground running.
Okay, any more questions about vaccine administration or accreditation or anything else we've talked about? Okay, so we have, you just got 10 minutes added to your lunch break. Yay. Hang on, let me get back to the agenda. So I lost it.
So I think we're starting back at 12:30, right, Julie, for our, you want to remind everybody who's
Yeah.
coming?
Yes, I was
If
looking
it's coming
for the time. Yeah, 12:30. Okay, so we have. Please be back by 12:30. We are having Tara Reinders speak to us this afternoon, and we've set it up so it's a little bit like the Helen Joy George presentation from the last retreat in August. Tara Reinders is a nurse. I'm sure you all have had the opportunity to read some of her information in the emails about the meeting today, but she's a nurse and she has a master's in fine arts and dance, and she has combined those two loves and skills into helping people heal from trauma, most recently from COVID. But it's really a nice mental health presentation, and she's amazing. And so she's going to show us her work. You're going to have an opportunity to ask her questions. So kind of that give and take, like as if she was doing a reading like Helen Joy George did last fall. So I think it'll be really cool. And it's going to be an hour. And she is doing this with the Actors Theater of Louisville. And there's a connection with the college via Juanita Fleming. And Janie's going to tell you all about that when we get back at 12:30.
So welcome back, everybody. We're real excited to continue on with our spring retreat forward with a special presentation by Tara Reinders. So this is being made possible in partnership with the Actors Theater of Louisville. And just so that you all remember what we shared earlier, Tara is a nurse and she's the artistic director and founder of the clinic. And before we move any further into the program, I just want to ask everyone to please put your questions in the chat box that you may have for Tara and the work that she does. I'm also going to ask that you make sure you keep your mic on mute, and we will be recording this session. So some of you may remember last fall, we had a special night, and we'll flip to that slide just to remind everyone when we had a wonderful mega celebration of alumni stars. And we had a special moment where we recognized and honored the life of our beloved Dr. Juanita Fleming, who is the very first African-American faculty member in our college, a member of the American Academy of Nursing as a fellow and also as a living legend. And so I always like to share for those that aren't familiar with that, that is very impressive. It is the Mecca, very prestigious. So I can just tell you that Juanita is smiling down right now because it is her son who is the CEO of the Actors Theater of Louisville who made this possible. And I just think it's just wonderful that Robert was able to introduce us to Tara for this special session that we're going to have, because he really does recognize the important work that nurses do, that his mother did, the important healing that we do. And this is going to be our opportunity to see how nursing and the performing arts can come together. So with this, I'm honored and thrilled to introduce everyone to Tara Reinders, all the way from Colorado.
Thank you, Janie. Thank you so much. Hello, everyone. My name is Tara Reinders. I'm really excited to be here with you all, to be part of the UK community and spend this time together. I'd like to share a little bit about the work that I've been doing. And before I get started, I'd just like to say that this work was done over the past 5 years, and I would like to acknowledge my role in upholding racism and my biases and the work that I have done. You'll see photos and video, and it reflects the white experience. And so you'll see most recently our Resiliency Moments does have, we hired some really incredible and experts in the arts, 2 Black women who I'll be showing later, but I just would like to first recognize that. So thank you all so much. You can do next slide, Emily. So the clinic is, I'm the artistic director of the clinic. It's an arts-based immersive theater company that is based in Colorado, but we do virtual experiences around the world. And we created immersive theater performance in Rose Medical Center, as well as workshops that are arts and play-based and resiliency moments. So I'll be speaking more to some of this in just a moment and showing you some video. These are our co-directors. This is Leah Bonfilio, Claire Hamor, and Jad Tank. Leah is an artist based in New York City. Claire is based out of Denver, and Jad is from Lebanon and based in Lebanon and Houston. And together we are the creators and co-directors of the clinic. My background, I'd like to spend a little bit of time here. My background is in nursing. I've been a nurse for over 15 years. I've worked primarily in the emergency room, but I've also done medical surgery as well as the infusion center. And I started as a CNA, and I worked as a CNA for 5 years before that on the telemetry unit. And I have been a dancer my whole life. Ever since I was a little girl, I was in classes and performed, and have always kept resiliency or dancing as part of my resiliency, as part of what makes me whole and grounded. And you can see those are my twins. They are about maybe a year here. They're currently 5 years old now, and you may get a guest appearance of them at some point during this presentation, just to warn you. But they are now 5 and doing remote learning, but in kindergarten. So I'd like to share just briefly some of the background that brought me to this place. I've experienced a lot of loss, like many of us in our lives, but and this loss has led me to this place of bringing the arts, my resiliency, alongside nursing. My mother at 49 was diagnosed with cancer and passed away, and I was 26 at the time and the oldest of 4 children. And with no father in the picture, I became the mother very quickly in our family. And shortly after she passed and my youngest sister was 16, went to college, that I decided to go back to school, to graduate school, and get my degree in dance. And that was really important for me. It was a time that I needed to really grab onto what cared for me in that moment. And that was dancing. So I went back to school and studied dance for 3 years and received my master's. During that process, like, I think a year before I was finished, my sister became extremely ill with a disease called acute disseminating encephalomyelitis. And she is now a quadriplegic and cannot speak. However, she's mentally there 100% in her brain, but she's locked in her body. So she went from a 26-year-old mother with an 8-year-old daughter and to someone who could not move in her body. And so I take this time to describe this experience because it really is what created these one-on-one artistic moments for healthcare providers that I'll get into later on. But I lived with my sister in the rehabilitation room, and I spent time with her, bathing her, being her voice when she couldn't speak. And I developed this understanding of holding the joy alongside these intimate moments of what it's like to care for another person in that time. And so it became a very important framework for how I realized that as we care in our joy, as we care in our grief, we also are caring in our joy, and how those two worlds are held together. And I took a year off of graduate school to be with her, and I was able to come back and create something based on that experience. The other was my brother at age 30. He was diagnosed with schizophrenia shortly after my mother passed away. And he wandered a lot. He was a wanderer. So he was in and out of jail for trespassing many times in his life. And unfortunately, when last time he went into jail, he ended up going to the hospital for complications with a wound that he had. And he refused care when he was in the hospital. And of course, things are very complicated, but he refused care and ended up dying without family being told what was going on. And so my brother died in the hospital with no family at age of 30. And that to me really brings me to this idea of our bias around maybe someone who's coming in from the jail system, and how are we or not supporting those patients as well. So I'll just leave it there, but the main things to take away is that with my mother, with her death, I was able to return to my dancing as a means of caring. And for my sister, I had these incredible one-on-one, intimate, vulnerable experiences with her that led to creating these moments with other people. And as I said, with my brother. And then lastly, I had an ectopic pregnancy when my twins were 6 months old, and I almost died. And I realized in that moment, the care that my nurse gave to me when they called a code yellow, and my room was full with people, and I was in Trendelenburg, and I was passed out, but I could hear everything. And the moment my nurse grabbed my hand and she said, "I'm here and you're going to be okay," I remember thinking, thank you for remembering me. Thank you for remembering that I'm a person in here who's really, really scared, and I'm scared that I might die. So thank you. And I remember thanking her in my mind during that moment. And that made me realize how important we are as nurses and healthcare providers. We have this opportunity to jump alongside somebody in some of their most intimate and vulnerable and horrendous times of their life to make a huge difference. So that's my background leading me up to this place. So the clinic, why this and why now? It's really important that we recognize the burnout and what we're dealing with. And I think this slide was more applicable pre-COVID, because I think we all have a pretty good grasp now of why this work is important. So the clinic has multiple offerings. We have First Do No Harm, an immersive theater performance, our workshop series, COVID stories, resiliency moments, creative caregivers, a nurse's calling, and knowledge sharing. And I'll go into some of those next here. So I'd like to just stop right here for a moment and just take any questions. I don't see any in the chat box, but I'll just take a brief moment if anyone has any questions on the background of the clinic. All right, let's go ahead and move on.
Wait, Tara, sorry. I couldn't find my mute button, my unmute button, but I have a question.
Yes.
So how did you get from all of that to starting this clinic, or are you going to get into that story as you go through this?
Yeah, that's a good question. So I am going to get into it a little bit, but I'll just say that I knew that I had to share this information that I received as a patient, that it felt very pertinent to my role as a, one second. Yes, darling.
Someone turn the movie off and we
Okay.
need you to help us.
Okay, you're gonna have to figure it out. I'll be there in a
I
moment.
can't.
Okay, okay, I'll be right there.
Phone number.
Okay, thank you. So when I had that experience as a patient, it felt really important to share my experience of being flipped as a patient instead of a healthcare provider as the first time. That was such important knowledge. And so that we don't get unless we're in that, unless we're in the shoes of our patients, literally. And so I began by meeting with my CNO and asking, can I have some time with our nursing leaders? I just like to share my story with them. And I wanted to do it through the arts. So I had a 1-hour meeting with all the nursing leaders. There was 100 of them. And I led them through an arts-based experiences that helped them to realize what it could feel like to be a patient. So we did a slow 5-minute walking, as slow as you possibly can for 5 minutes. And I said, that's 5 minutes. Because I remember the moment I asked for pain medicine and how long it actually took to get the pain medicine when I was in excruciating pain. And 5 minutes can feel like forever to a patient, but to us, 5 minutes goes by in a second. And so that was one example of ways that I helped offer empathy for what it felt like to be in the shoes of our patients. And then from there, things just started to be created. I wanted to raise awareness of burnout and fatigue because I didn't like asking more from our nurses. I wanted to be able to show, we need more support. We need more care in order to give the care that our patients deserve. And that's where we created the immersive theater performance, which I'll get into next.
Thank you. We do have one more question. And it's from Dr. Hahn. So is the focus tertiary care, or is there anything you do with public health or prevention?
Yeah, the focus is not tertiary care. It is open for healthcare providers. And specifically, we've been working with nurses because that's my background, but we've also worked with social workers in hospice settings. And so it's really the focus is on caring for healthcare providers in whatever means that is, and whatever population that they work with, because it means we're caring for the caregivers in order for them to care for whether it's in public health, primary care, inpatient, whatever that may be. Thank you, Ellen, for that.
I don't see any more right now.
Okay, great. So we'll move on now to our video of the workshops that we did. This is just to give you an idea of what we created and the spirit around that.
I remember not really being able to have the compassion for somebody in their situation that I used to have, that I felt desensitized to their pain and their suffering. And after that, I realized I was tired and I was experiencing compassion fatigue. My name is Tara Reinders. I am a nurse. I've been a nurse for over 15 years, and I'm a dancer, and I am the artistic director of the clinic, which includes resiliency workshops for nurses and an immersive theater performance that takes place in the hospital setting to raise awareness of compassion fatigue and nursing burnout. The clinic is a 6-week workshop series for nurses to combat compassion fatigue and burnout through resiliency training with the arts, music, dance, and performance. It's based in play, so it brings us out of our heads and into our bodies. And just like children, we get curious again and we start thinking about things differently. We start questioning things. We use theater and acting and role-playing as a way to address certain really deep and tough questions and issues at hand, but do it through a playful lens.
I was surprised at what came out of that and what actually was causing grief that I was holding on to. And it was so great in all the different ways that we visited with the movement and sharing our stories. with other nurses who I think when they heard them can really relate and connect.
I think just stress lives more in your body than you ever realize. And I think something that happened 50 years ago can be completely in your body, and you know about it. You hear about veterans from war, but you don't really know how it affects a person until you let it out.
Some of the worst days feel like they are connected intrinsically to who you are in this profession. That my value as a nurse is how I can take care of people. So on my worst days, does that mean I'm not doing a good job at taking care of people? And it's being able to kind of disconnect those two ideas.
So what motivated me for this workshop series is I had an experience as a patient where I almost died, and I realized how important nurses are, that they are everything to a patient. And I began researching patient outcomes, patient experiences. I wanted every patient to feel seen and heard and cared for every time. So I realized that compassion fatigue and nursing burnout was stealing the joy that we nurses can receive from caring for another human being, and that there's a huge need for our nurses to be supported and cared for and seen as nurses. The hospital benefits from every employee caring for themselves, because when a nurse is caring for him or herself, they're caring for their patients, and they are experiencing satisfaction as a nurse. They're empowered to care for others in a healthy way, which decreases turnover, increases patient satisfaction, nursing satisfaction. Ultimately, everyone wins.
This is a program for nurses by nurses, and I think that's one of the most important aspects of it is you're being understood, heard, and seen by someone else who has been through what you've been through, and maybe different stories, but the underlying theme is the same.
Working with performers has been a totally new experience for me, very outside of the box, and it's been a fun, new approach to looking at a serious issue.
Identifying that story and finding the ways to move to help you identify how that story really impacted you, emotionally and physically. Didn't even think that story affected me until she said that prompt, and I was like, oh, I remember that. Yeah, after that I was pretty pissed. And then I was like, wait a minute, I was more than that,
Being able to move my body helps me move through certain pieces of my story that weren't necessarily as comfortable. And seeing other people struggle with the same things I struggled with, it built a little bit of a camaraderie around, everybody who was in the group, that nobody's going through it alone.
A really important component of this workshop series is the IRB-approved nurse-led research study that we're doing, and we will continue to do with every workshop series, so that we're gathering data to create evidence-based practices that can be used for nurses, but also brought to the bedside and used for the care of our patients.
All right, thank you, Emily, for playing that. I think that does a good idea of offering you all an understanding of the spirit behind the work that we do of the clinic, of it being based in play, in the arts, in vulnerability, and this idea of holding self-care, but moving through self-care into collective care. And so that what we do as nurses, as healthcare providers, as healers, that we're bringing this care not only to ourselves, but to one another, that we're hearing each other's stories and we're saying, yeah, me too, I get that. And a lot of the feedback was nurses saying, I go home and I tell this to my partner, I even tell this to my therapist, but they don't understand the depth of the grief and the pain and the trauma that I hold in my body, the way that another nurse or healthcare provider understands, because they have been in it with me together. So one of the participants in the workshop gave me this quote, and I thought it was very applicable to my story as well as I think all of us, is that nobody escapes being wounded. We are all wounded people, whether physically, emotionally, mentally, or spiritually. The main question is not how can we hide our wounds so we don't have to, how can we hide our wounds so we don't have to be embarrassed, but how can we put our woundedness in the service of others? When our wounds cease to be a source of shame and become a source of healing, we have become wounded healers. Henry Nouwen. And I think this is really important because what we do at the clinic is we offer space for people to be honest and to tell the truth about where they're at emotionally, where they're at in many areas, and to come alongside that and use that as a space for healing. So First Do No Harm is a performance created with my co-directors, is an immersive theater performance. And that, I don't know how many of you are familiar with immersive theater, but for me, my definition of immersive theater is that it's interactive, that the participants are involved in some way, that during the performance, there's really not that wall, there's not a stage and chairs watching, but we're bringing you along in the journey, that you are experiencing this from all different spaces, and that you're caught up in the play, in the movement, and in the emotional understanding of the characters. You're right alongside them. So First Do No Harm was set in 2018. So remember, this was like pre-COVID, a lot of stigma still around mental health issues, especially for nurses. A lot of nurses, healthcare providers not wanting to admit that they needed help, that there was even an issue here. So I'm going to just show this quick promo, and I'll show another video of a more in-depth view of this work as well. But this happened inside the hospital, and it was open to the general public, and we charged for tickets, and we sold out every night for 8 nights, and then added 2 more shows and sold those out. So there was this hunger, this desire to see kind of the inside perspective. And the beautiful thing about this performance, it was told from the perspective of nurses and from the perspective of the patient's family members, which are really perspectives we don't hear very often. So that was just a quick clip of kind of a bunch of different scenes put together. We'll go ahead and go to the next slide, and I'll just break it down a little bit for you. So First Do No Harm started inside the main entrance of the hospital, and they actually shut the main entrance down for 15 minutes and just escorted anyone who was coming and going just around the corner for us to be able to use this entrance, which was pretty amazing that they allowed us to do this. Especially, I think of this now, trying to do something like this during COVID. And it's kind of mind-boggling that we were able to do this beforehand. So we performed inside of these glass doors to give this appearance like that we were actually operating inside of this surgery center. And you can go to the next slide, Emily. And you can see the audience is on the other side of the doors, and we do this performance, and I'll show a video of this, so we could go to the next slide. And the next slide. You can see we have live music. We also have in the back corner there our anesthesiologist, who was our DJ, also doing some live mixes as well. The violin. And then if you'll go back to two more, Emily, sorry. You'll see here that this was the connecting hallway from our hospital to the office buildings, the physician office buildings. And we use this hallway as a means to show different perspectives with the movement, which you'll also see. This next slide is inside a hallway where lab was, but we utilized this vending machine for this monologue where the nurse expressed her feelings of inadequacy and fatigue and burnout, and life as being not only a nurse and a caregiver, but also raising children at the same time. And this was a really interesting room we found when we were researching the hospital for spaces to perform. And I had never seen it before. It was this huge room full of beds. It looked like a graveyard of beds. And so we put in a red light, we covered all the beds with sheets. And there was this really beautiful moment where the wife to the patient is having a breakdown. And you get some more background on her relationship with her partner, but you also see the sadness and the grief that she's going through as she's slowly realizing that she's losing her partner. This is Death, played by Leah Bonfilio, and she's one of the co-directors and performs with Third Rail Projects in New York City, and she did a really beautiful job holding the space as Death. And so Death would come in and out of the story and pop a balloon, and that means that a person was taken away and died. This was an interesting scene, and not everybody saw this scene. So during the performance, they split up into groups and everyone went to these different areas. Some experienced all similar scenes, but some got to see scenes that others didn't. And this was one of those scenes where Death explains to the patient the pathophysiology behind a widowmaker, behind this heart attack that this patient was having. So it was really this intimate conversation with death and facing your own death and facing the exact reason why you're dying, and involving the guests, the audience members in this conversation as well. And then you'll see in this next slide, this reckoning that the patient is having with his own death. And then the next slide, you'll see actually the audience members walking the patient to his deathbed, literally. And this is this one last interaction with the wife saying, "You cannot die." I'm getting choked up right now, but "You cannot die on me. You have to stay living." And just a really heartfelt moment when that she gets to say goodbye in her own way by telling him not to die. It was her last goodbye. And then ultimately you see this, she just did such a great job playing this role that is bringing back these emotions for me of feeling sad. You see I'm doing CPR, and there's live music, and it was really dramatic and pulled on the heartstrings, but you watch her, as healthcare providers and myself working in the ER, I've seen this face so many times, this loved one losing someone, but this experience was really powerful and hard for a lot of people who have never seen this before. And then we bring everyone back to the chapel, and we have this reckoning of what just happened. And we do that through dance and movement and joy. And we make the case that the amount that we grieve, the amount that we lose, is the amount that we're able to feel joy. And so we hold again, like I did with my sister, these two worlds of caring and suffering and tragedy alongside the beauty and the joy that still exists. Not one doesn't mean it takes away from this, but we just hold those two worlds with each other, and we get curious about it. And so I'd like to just show this one last opening scene, which is more of like an insider's view of the opening scene inside the entrance of the main hallway. So that's just a little bit of a closer behind the scenes view of the actual action. We received a lot of recognition in media for this performance alongside our workshops from Newsweek, and we're highlighted on PBS NewsHour, which was really, really great. And received in 2019, I received the Nightingale Luminary Award for this work as well. But what really brought me the most joy and grounding in that this work is so important was not the recognition publicly, but the words that were spoken after from the nurses and the doctors. And I think that's on the next slide, Emily, speaking to the slew of emotions. They felt so amazed or felt so moved and cried and laughed and guided to release a lot energetically. And then a physician, it captured, it spoke to the decades I have spent witnessing others' grief and captured the fatigue that we are all vulnerable to feeling. First Do No Harm has brought a new reality to our hospital through the beautiful art of dance. By far the most artistic, emotionally, and powerful performance I have ever seen. I laughed, I cried, I gasped, and nodded a lot. These emotions continue today as I try to explain to others. And I think this was what the goal was to take away the stigma, to honor the work that we do by telling the truth. And I'll keep going back to that because I think in our profession, we hide a lot. And I think emotionally, we need to start telling the truth about how we feel and about what we are going through. And it's only then that others are able to tell their truth as well. So I'd like to just stop there for a moment and see if there's any questions that I can address at this time.
There are a lot of kudos in the comments section. Outstanding, mesmerizing, made me teary, bringing up a lot of stuff. Dr. Moreland, who is the chief nurse at UK Healthcare, asked about the 6-week workshops. Is it a weekly guided workshop? Does it work best with a team? Or have you had nurses from multiple areas at one workshop?
Yeah, that's a great question. Thank you, Gwen. The workshops is a guided weekly 2 hours each week for 6 weeks. And what we did, and given COVID, we're having to operate differently, but we opened it up to all direct patient care nurses in 2 hospitals. So the Medical Center of Aurora, as well as Rose Medical Center, 2 hospitals in the Denver area. And we brought in the nurses, and then we also had like 8 to 10 artists join us as well. So it was really nurse and artist, this experience of bringing these 2 worlds together during the workshop series. So they came from all multiple areas, from the ER, from the ICU, from the med-surg, which, as many of you will know, doesn't make, it adds a lot of variables for the research, but made for wonderful conversation and best practice sharing within our time together.
Thank you.
Yeah, thank you.
I was just thinking of some of our teams that have been most impacted by COVID. Everybody's been, of course, impacted, but those teams have been most impacted, and wondering if that, smaller team working together, if that would be beneficial because of what they've shared together.
Yeah, I think you're spot on with that. And because that's something, even though these nurses had never necessarily worked together, they developed this really deep relationship, community, camaraderie with one another through the sharing. I'll get into more detail of their grief stories, and they actually didn't want to stop meeting. So we've been meeting for over a year now, every month, continuing this work together as well. So it is, I could see how impactful it would be for a team in that group cohesion as well, and community building, absolutely. Great question, thank you. And I think that was it. Is that true, Julianne?
Yes.
Okay. So I just wanted to break down briefly the theories and of the trainings of the workshops. And then I'll get into the resiliency moments that we created in the midst of COVID. So we're using Jean Watson's theory of human caring as really as our basis for the work that we do. but we're really also grounded in the See Me as a Person framework. And I'll go over that and relationship-based care. We use play theory, disruptive innovation theory, trauma-informed care, and the tenets of animating democracy to help us evaluate the work that we're doing in order to navigate this idea of art for social change. So the See Me as a Person framework, this is a quote from that. Authentic connection can be learned, practiced, reflected upon, continuously developed and mastered. It is through presence and attunement that you convey the essential messages in nursing. I see you. I am interested in you. I give you my full attention. I am here and you are safe. Presence is not what you do, but it's the way that you are. It is a state of being. You cannot connect to another without being present and attuned. So the framework is attuning, intentionally connecting with people exactly where they are and remembering that what might be routine for you is often life-altering for the person receiving care. Wondering, curiosity, questioning, a practice of discovery, grounded in curiosity and genuine, authentic interest in the other. Tell me more about that. Learning about the person is fundamental to the provision of safe quality care, alongside learning about the family, asking the family members questions. The practice of listening to, oops, do you mind going back? Thank you, Emily. The practice of listening to, respecting and acting on what we actually learn and going from that place to holding, creating a safe haven. So this framework is how we created the curriculum for our workshops. We started with attuning, wondering, following, holding, then went into our grief stories. And you saw in the video where each nurse was talking and sharing. We wrote grief stories, and there'll be an example through the COVID stories that we do, where we wrote out our stories. I remember when, and we wrote out our story about a patient experience we had, something that affected us deeply. And then the story went to say, after that, and then we wrote about how it made us feel. And then we circled words, and this was an exercise I did with my professor, Onye Ozuzu, in the University of Colorado at Boulder, who's now the director of dance at the University of Florida. And we created movements to different parts of our story, to different words, gestures that represented those words. And then we created a dance with them. And so they went in the middle of the circle and shared their story through movement and speaking as well. A play framework, Miguel Sicar is a theorist in play. And so play is an activity, while playfulness is an attitude. So it's an attitude we brought to the whole workshop series. An activity is a coherent and finite set of actions performed for certain purposes, while attitude is a stance toward an activity, a psychological, physical, and emotional perspective we take on. So the nurses immediately came into this experience of play. They did not know what to do. We really disrupted their normal way of thinking. And then we also use trauma-informed care. So in this next section, I'll talk about resiliency moments. We're using these theories along with trauma-informed care to actually train the artists. So the artists are all trained in these nursing theories. The artists are trained in trauma-informed care so that the spaces that we're creating are actually holding and caring instead of perpetuating trauma. And quickly, just disruptive innovation theory is actually a business model of going and disrupting. And so one of the main tenets of this work is disruption. Like, how can we come in and totally disrupt the way somebody thinks? Because it's really then that you're able to see things differently and experience things differently. As nurses and healthcare providers, we are in control 100% of the time, because if we're not, someone may die. So that we have to hold that space for them all the time. What this did was put the nurses in this place of like, I have no idea what's going on right now, and I'm not sure what to do. And we came alongside them in that moment and supported them through play and doing fun activities and role playing and giving them the tools as they needed them. But it helped them to start thinking differently and think creatively. We use the aesthetic perspectives of disruption, commitment, communal meaning, cultural integrity, stickiness, resourcefulness as a means to evaluate the work that we're doing. And this was created for that very reason. So a lot of granting agencies who give money to arts for social change will use this as their framework to evaluate work, to make sure that the art that's being creative is rigorous, as well as the programs are rigorous and following these perspectives. This week, like I said, we did an IRB research study, and these were our results. We used the ProQual Professional Quality of Life Survey pre and post. So right before week 1 and then post at the end of our last session together. And we had a very small sample size, so these results are not statistically significant. I believe that's one of the reasons, but either way, we did see a decrease in burnout and secondary traumatic stress, and with this suggesting an increase in empathy as well. We also shared our grief stories. So in the workshops, the nurses, as I said, spent time developing these grief stories. Then we spent time bringing our grief stories together for the nurses to share as one performance. And we brought that to the executive team. We performed for the nursing leaders, the executive team, and for the clinical nurse coordinators of the hospitals. And it was like over 100 people plus that we performed this for, and it was really powerful. And this was some of the feedback, I'll let you read through that, really helped, the feedback that we received after they watched that performance. And really what they're saying is, me too. Thank you. Yeah, you're portraying what I'm going through. And that really is the antidote to shame for feeling these feelings or not knowing what to do, is empathy. So I'll just stop there if there's any questions. So I just see I appreciate your emphasis on how we must move beyond self-care to caring for each other in addition to our patients. It is time for organizations to invest in resources for nursing staff. Yep. Thank you, Melanie. 100%. And I agree wholeheartedly. There is a great need from Lee Welmsley. Sorry if I didn't pronounce that correctly. There's a great need to understand the impact of trauma on both ourselves and patients. Secondary or vicarious trauma is something that most, if not all, nurses experience without even knowing it. We would all be better served by understanding more about how we are affected by taking care of others. Yeah, yeah. Thank you, Leanne. I agree. And I think this is really, this work is raising awareness of that and creating a safe place for people to talk about it. And then bringing in the experts as well alongside the arts to care. Morgan, I really resonate with taking away the stigma of allowing our care to affect us. What if as a healthcare community, we set the expectation that this work will affect you physically, emotionally, and mentally, and we offer programs to help mitigate that as part of your paid time, because this is a direct effect of what you do. I love that. I think that would, that would be incredible for that to be part of the job description of going in. And I think that also starts in nursing schools. That's what we're setting people up to understand. This work will, I love how you said that, Morgan. This work will affect you. Boom. Yep. And Kent Brower, you mentioned having a DJ in your videos. How has or will music play a role in this going forward? I think music as itself can be a wonderful tool, but added with dance, this can be very powerful. Yeah, I agree. The music for the performance was really everything. And to see it in the hospital setting, which you don't see normally, you know, to hear a violin in the hospital was just so powerful. And I will be speaking more about how music plays a role in coming up here. Did you have any resistance from nurses, and how did you deal with that? Yeah, I think there was some resistance, especially in the workshops at first, not knowing what was going on. And I think we could have done a better job offering more preparation for them, and moving forward, we are what to expect. But the resistance, how we dealt with it was with support. So immediately if there was resistance, one of the artists would come alongside and say, hey, let's try this together. And, or do you need a minute? What's going on? What do you need right now? And really, and it was less maybe support or less resistance and maybe a little bit more confusion of like, what is happening right now? What world am I in? What did I just walk into? And so it was maybe a little bit more curiosity and wonderment than resistance. But I haven't had really met with really hard resistance based on the preparation that we do to create the space that allows people to come into it. It's a lot of preparation up front. And then Kristen Ashford would love to see this work also offered at our UK healthcare substance use clinics and our community organizations, Voices of Hope. Yeah, I would love to talk more with you about that. I think this work is really important, especially in those, high burnout areas as well. All right, thank you all so much for your questions. Okay, COVID stories. So in the midst of the pandemic, we created, how are we doing on time? We created COVID stories, and I'm gonna skip this video, Emily, so we can move on. This video is on my website, so if you're curious, then I encourage you to go. But this really was an extension of our grief stories. And like I said, the nurses wanted to meet monthly, and so we continued to meet monthly. Even during COVID, we started online meeting virtually. And then at one point we met in the park and social distance, and we wrote out our COVID stories, starting with the same prompt. I remember when after that and really looked at the actual experiences of being a nurse in the midst of COVID, created movement. We learned each other's movement. So that was another part of this, is really taking on each other's stories and collectively experiencing them and collectively caring for each other, moving through the self and into the we of this. So I'd like to jump into resiliency moments, because this is something that can actually be happening now. And it's a virtual experience. And what it does is it brings nurses and healthcare providers together with artists from all over the world. And that was a really beautiful thing, to be able to bring in voices virtually that you aren't able to do in an in-person setting. So Resiliency Moments, as it stands right now, is a 1 hour, I'm in the middle of developing a protocol for this multi-site study. So I'm going to call it an intervention as well, but an experience, a 1 hour experience for healthcare providers to join with a group of artists at the same time. And Emily, I also have most of the videos for these are at the clinicperformance.com, just FYI, so you have that URL out there as well. So this is Leah Bonfilio, one of our artists. Her resiliency moment is a mini immersive theater experience that brings together storytelling and gardening. The guest witnesses the planting and watering of a lily bulb while listening to a reading from The Secret Garden. She or he is asked to dedicate the lily's growth to someone or something. The artist makes a promise of cultivating and tending the lily and sending photos of its progress to the guests. So let me back up just a moment. Everyone signs on like we all are now. And let's say there's 10 of us here. So there would also be 10 artists on the call. There's a hostess who welcomes everyone. It's a little bit theatrical and fun and grounded in play. And she lets them know what to expect. We do some technology issues. Can I see you? Can I hear you? And then we have a moment. We take a breath together, which I forgot to do with all of us at the beginning, but I'll do one at the end. And then we get taken into breakout rooms. So when you go to a breakout room, it'll be just you and the artist, one-to-one, nobody else. And the artist has created this world for you. So you come into this world, like you can see Leah holding up her curtains. It's like you're peeking in, and she opens up her curtains and then shows you, then you just see her hands digging in the dirt. And she talks to you about gardening, and then she reads you a story, and she asks you, what's something you would like to let go of in order for something to grow? So it really is just this moment of you feeling seen and heard as a healthcare provider and tended to through an artistic medium. This is Kelly Greenlight. She was is based in Nigeria and was able to virtually come in for these as well. And her moment was incredible. She began with this singing. So she asks you to close your eyes, and she just sings. And it's just, it takes you to this incredible place to just hear her singing this one song just for you. And then it's a moment for you to sit and receive. And it evolves into thinking about nature. And she talks about how nature was very healing for her and her grief, and asks you some questions about places you like to go, nature you like to experience, and the healing power that nature holds for us during some of our most difficult moments. And the participant is left swimming in their natural habitat, whatever that may be, and that brings them peace as their moment ends with her again just singing, and she has the most incredible voice. This is Jad Tank, and he was virtually coming in from Lebanon, and he leads through gestures. So asks you, similar to our grief stories, but asks you about someone or something. It may be a pet or a loved one that you have lost, and asks you questions about it. And then you create movement, and then you create this dance together, and you end up, and you use this dance in repetition over and over again. And he does it with you, and you're honoring this person through movement. And then you have this dance. So whenever you miss that person, you're able, or that thing, you're able to do that dance for them. And comfort not only yourself, but have comfort knowing that another person in Lebanon knows this dance as well. This is Sun Chung. She's an artist out of New York City, and she created this really beautiful green, you come in and it's all green light, and she has this singing bowl that she plays. It's again, this the use of music here, singing and the singing bowl to transport you to a different space where the air is just filled with this music, and there's moments of memory, moments of stillness, and moments of breath, and you're gently guided to find a new grounding, a new lightness in your body. Abby Ahmad, based in New York City, the musician and the nurse co-create a song together based on prompts. So she has, you can kind of see, but has like hundreds of guitars and different instruments behind her. And you get to, she shows you different strums, shows you different instruments, and you get to choose what you want. And then she asks you questions. And based on your questions, she creates a song for you in the moment, records it, and sends it to you. Let's see, we'll have to skip this one as well. These are just some nurses' testimonials, but I want to be cognizant of our time together. Any questions? No, okay, we'll go ahead and move on. So next steps, let's go to the next slide. So I'm currently partnering with HCA, Hospital Corporations of America, to offer a multi-site research study to over 30 different hospitals, bringing this, the resiliency moment specifically to them with, as like I said, we're currently writing the protocol for that. And then I'm been asked to do some keynote speaking around this work as well for the EduCare Symposium, and was just asked by the Oncology Nursing Foundation to be their guest lecturer for the, it's a guest lectureship for the year 2021. So that was really honoring, and I'm excited for that. And then I'm looking into, I've applied to get my PhD as well. So that's kind of where we're at with some of this, and bringing the workshops and the performance when it's possible to hospitals after COVID. And we are creating a virtual workshop series right now that we're able to do, we'll be able to do virtually. And then I'm also doing a one-woman performance in Denver called A Nurse's Calling that really is focusing on our grief, focusing on the burnout as a baseline pre-COVID. And then where does that leave us now? If we were already burnt out, where are we now? Asking those questions. And then also asking the question, what is the role that I play as a nurse in upholding racism at the bedside? What is the role that I play in health inequities and health disparities? And what is the role that I play as a nurse, but what is the role that we play as a community of healthcare providers? And then again, it goes back to telling the truth and confessing. And for me, that as part of my anti-racism work will be also a huge part of this performance. And we'll skip this video too. And then I don't know if Robert or Emily, if you would like to talk a little bit at this point of the partnership that we're developing.
Sure, I just thank you, everybody. It's such an honor to be here with you, Tara, and with all of you nurses at UK. I'm Robert Barry Fleming, the Executive Artistic Director It is through our extraordinary artistic producer, Emily Tarquin, that I had the good fortune to know of Tara's work. I am so honored the kind of care and honoring you gave to my mother. And obviously, I'm highly motivated to see a partnership and an opportunity to participate in these resiliency moments and create a healing space for our heroic frontline workers in the helping profession of nursing. Nothing seemed, as a choreographer, artist, and son of a nurse, more fitting to be able to make this opportunity the beginning of flowering, some way of flowering to be of service to a community that has given so much and has been so heroic in a very challenging year. So I'm most grateful for this opportunity, most grateful for Tara sharing her brilliance and her care, and very excited about the R&D aspect, and most importantly, the healing possibilities. Emily, would you like to take a moment to share?
Yeah, I'll just add, of course, just my love and gratitude to all of the people in this room for the work that you do. You know, we experienced a different side of the pandemic in our industry when we shut down our public performance, and it has also unlocked something new for us. And, you know, see Tara's work as an integral part of that, the beautiful intersection of art and service. We want this to be part of our storytelling revolution and our work of service to you all, and just excited to get to share this with you. Tara, go back to you.
If it's okay, at this point, I would like to close by saying thank you to Tara for sharing your journey and the work you're doing. It really is breathtaking. Now we're recording this and we will share all of the notes, but everyone was mesmerized. I saw tears in the eyes. You read the comments. Your work is breathtaking. It's uplifting. It's inspiring. And we thank you, Tara. We do. We really thank you for all that you're doing. Robert, oh my God, your mother is just so beaming. You have that soul of a nurse. And I thank you so much, you and Emily both, for bringing Tara to us. I mean,
thank you, Jenny.
You know, you just sent me her web link and said, check this out. I know that you're worried about mental health and wellness of nurses and the work we're doing here at the University of Kentucky. By the way, there's only one place to get your PhD, Tara, and that's with us. Okay.
Thank you, Jamie.
But Robert, you knew the work we were doing with resiliency and trying to build that culture of practices for our students, our faculty and staff, and all of our community at large. And you just said, check this out and see what you think. You and Emily made it happen. And I cannot thank you enough for helping us see how we can bring the work that we do as nurses together with the performing arts. It is such a gift. Today has been such a gift.
Thank you so much,
to be able
Jenny.
to sit and receive such a beautiful presentation. So on behalf of everyone, our college at large, our community partners, we had a lot of colleagues that joined us, state leaders in Kentucky, leaders with our Kentucky deans and directors. We had leadership at UK Healthcare Nursing, Medicine, as well as interprofessional education and our area health education center. Breathtaking, and we cannot thank you enough. And I will just turn it back over to Julie on behalf of the faculty and staff of the College of Nursing. If you have some closing comments, we've all got your contact, and nothing but greatness is going to continue to come out of this. I just know it. I'm so excited.
Thank you so much for your enthusiasm.
Thank you, Jamie. Thank you, everyone.
Well,
Julie, you want to close this up?
yes, on behalf of the faculty, I want to thank all of you for bringing this to us today. I want to thank you for the work that you're doing and where this came from, Tara, and what all the work you've put into it. It's amazing. For faculty, we would really like to hear your comments about this. So please feel free to email me or someone from Faculty Council. And I see your chat messages and in the box. And but if there's something else you would like to convey, feel free, and we will pass comments along as appropriate. Thank you, Janie, for bringing this to us also. And we'll be doing something with this. I don't know what, but we'll be doing something.
We will.
Yeah, thank you all for joining us today and staying and your attention, and have a great week. And here's to a different, lovely spring semester.
Tara, thank you again. It's an honor and a real privilege. Thank you so much. Thank you, Robert. Thank you, Emily. Thank you, College of Nursing, and all of our community at large for joining us.